Welcome. Today we're doing a deep dive into something really fascinating: transformative service and quality of life.
Hmm.
We've gone through a whole stack of research papers, and basically, our mission is to pull out how service design, the way things are delivered, actually impacts our well-being, sometimes in ways you really wouldn't expect.
It's quite surprising stuff, yeah.
Definitely. So let's maybe unpack this, starting with healthcare. There's this concept, evidence-based design.
Right. And that's not just like interior decorating for hospitals.
Exactly. It's about deliberately designing the physical space to help people heal. And it benefits everyone, patients, obviously, but also families, the staff.
The organizations themselves.
Yeah, thinking about things like what does it sound like? What do you see? Safety features, obviously.
And just finding your way around.
Yeah.
Wayfinding systems, dedicated spaces for families, for staff. It's all part of creating that healing environment.
It is. And what's really interesting is how that physical stuff connects, like, directly to our social and emotional side. You ever think about third places? Like not home, not work, but somewhere else.
Precisely. Your coffee shop, maybe a library, a park.
Mm-hmm.
So there's research on a cafe just for seniors. And the building itself, the activities, they actually help people feel restored, less mentally tired.
Wow, okay.
And similarly, in cancer centers, they found that direct social support, staff connecting with patients.
So talking, being supportive.
Yeah, exactly that.
Yeah.
It significantly improved patients' emotional, social, and cognitive well-being. So much so that some centers now actively manage this. They introduce support staff right from the diagnosis.
That makes so much sense. It's about connection.
It really is. Human connection within that design space.
Okay, but here's where, for me, it gets really interesting. We talked physical space, but what if the actual, human interaction quality is even more powerful?
Oh, absolutely. The research backs that up strongly.
Yeah, studies show that the sort of technical side, how efficient things are, and functional quality, plus your satisfaction overall, it all feeds into how you perceive your own quality of life.
Which is huge.
It is. And get this, improving the interpersonal side, like just basic customer service training for frontline staff.
Yeah.
It can create this thing called a selective halo effect.
Right. The halo effect. So if that human connection bit is good,
then your perception of everything else gets a boost. Things that are hard to judge, like the atmosphere, how things run behind the scenes, even the staff's technical skill or the final outcome.
yeah,
It all seems better, unexpectedly better.
it enhances the whole experience, even if other parts aren't, perfect.
Exactly. It's kind of a game changer. Okay, let's shift gears a bit. The digital world.
Mm-hmm.
The internet, as a service itself, it creates this unique space for what researchers call adolescent self-socialization.
Meaning kids figuring things out online without the usual adult guides.
Pretty much. They get more independence. They kind of co-create their own online environment, their own rules about stuff like deception, privacy, what feels real.
And that spills over into the offline world, inevitably.
Right.
But, this brings up a point. Digital services, they offer amazing connections, but there are downsides too, aren't there?
Definitely.
Like instant messaging, IM services, great for social support, staying in touch instantly, but studies link excessive use to risks like internet addiction
Oh, dear.
and even symptoms linked to adult ADHD in young adults.
Yeah.
So it's this double-edged sword, really, for mental health.
Yeah, that balance is tricky. And even just how information is designed within a service matters hugely. Take paying off consumer debt.
Okay.
Studies found if you only show the minimum required payment, the MRP people tend to pay less overall. It has this negative effect.
Right. They just focus on that minimum.
Exactly.
Yeah.
But if you also show the total interest cost and how long it'll take to pay off, that negative effect gets much weaker. People pay more.
So carefully designed information nudges better financial behavior.
Precisely. It can improve financial well-being.
And if you sort of tie all this together, these examples, from the tiny interactions to the big systems, you see this drive towards things like patient-centered medical homes in healthcare.
Right, that new model.
Yeah, it's about transforming healthcare, integrating everything, the whole person care, coordinated communication, so all your doctors and specialists are actually talking to each other.
Like a team approach for the patient.
Exactly. Learning from, the mistakes of things like HMOs in the past to build something that's hopefully more effective, more efficient for everybody.
So when you step back and look at all this, what's the big takeaway?
Well, I think it shows that services aren't just, transactions, from how a hospital is built to a tiny detail in an app.
They're designed experiences, and they deeply influence our lives, our choices, our quality of life overall.
Absolutely.
Okay.
Understanding that means we can see how the choices made in service design, they either add to or take away from our well-being.
So here's something to think about as you go about your day interacting with all these services. How could you become maybe a more discerning consumer of these experiences? Start noticing those powerful, often invisible ways their design is actually shaping your world.